All right, guys, so in this video, I'm going to talk about another factor that I think is driving the acceleration in the DSO space, and that is inflation and almost at this point, stagflation. So as you guys know, dentists work off fixed contracts. So Anthem, Delta, MetLife, all of those contracts are locked in place. So as inflation goes up, insurance companies still the fees are locked in. So there's been a lot of margin contraction these last 3 years as inflation has really picked up. And it's inflation in two factors. One, it's inflation in dental supplies and dental equipment and all of that. And then there's been massive wage inflation just overall based on the inflationary environment. And then with the labor shortage has driven even more of that wage inflation in the last 2 years. So you're having a couple things hitting at one time. Products are more expensive, staff is more expensive, and your reimbursement's the exact same. So that's a pretty big headwind for the industry. And then you take in all the other factors of the supply chain and everything else, and it becomes overwhelming. So I think the stagflation that we are now feeling is again driving that DSO acceleration, because a dentist now can work at a very efficient and well-run DSO and have the same compensation that he would as an owner dentist, and not have to work the 7 days a week and not do the equipment management and payroll and all of those other time-consuming tasks. They can focus on seeing their patient and doing that at a high level. Ultimately, I think that is the most successful model is going to be partnering with very good dentists. You allow that dentist freedom and flexibility in the clinic to operate how they want and need to operate, and we help on the back end services of recruiting, of staffing, of management, all of those non-clinical aspects. Again, I think that is long-term where the industry is going to continue to go. And I ultimately think if done well, that is a win-win for both parties. Comment down below if you guys think that the inflation and now almost stagflation that we're feeling is driving this kind of mass acceleration in the DSO. And comment down below if you guys think it's fascinating that insurance companies basically are paying the dentists the exact same fee schedules that they were in the 90s. Patients out-of-pocket max are still $1,000 to $1,500 is the average plan, and the fee schedules have not really changed at all from the 90s. We have a couple doctors that have been with us for a very long time, 25 plus years, and they like to remind me that the fee schedule is the exact same now as it was when they started. So comment down below if you guys have seen this as well, and let me know if you think this is one of those driving forces of the DSO segment. Thanks.